Hi, I'm Manasa Irwin. I am a family physician and I am the International Medical Director for Lalmba at the Matoso, Kenya site. So I am on faculty at Forbes Family Medicine, which I both teach and see patients there. We train future family doctors, and so a lot of what I do is teaching and supervising resident physicians both in the hospital and in the clinic. The team that I brought over with me is a family medicine resident, which is Dr. Kristen Coleman. The other person I brought over was my colleague, Dr. Mark Cohee, and he wanted to come and teach point of care ultrasound, which is a fabulous tool that the staff can use here to help with diagnosis of pneumonia, to make sure babies are head down when they are delivering. There's lots of uses for that, and so it was really great to bring him and use his skills with that.
Hi, my name is Kristen Coleman. I am a physician from Pennsylvania in the United States. I am a third-year family medicine resident, so I will be graduating in 2025. The impressions that I had of Lalmba before I came were very little. I knew of the location and I knew some of the general opportunities that was provided through Lalmba, including medical care and some work with some children at risk in the community, and then also some learning opportunities, but that is about all I was aware of.
Well, my name is Mark Cohee. I'm a medical doctor, family physician, and I live in Monroeville, Pennsylvania, which is near Pittsburgh. And so I've been here in Kenya with Lalmba for about 2 weeks now. I specialize in family medicine, and within that involves everything from taking care of babies to older adults and everyone in between. But I also have a focus on ultrasound, and so that's one of the things I've been teaching here.
I don't even know where to begin when I think about how my impression of Lalmba has changed since being here. In just 2 short weeks, I feel like I have really gotten a sense of not only what Lalmba's mission is, but also the people that work for Lalmba and the overall goals. And it has become so clear that the goal is to help people in the community, targeting multiple different facets of that community.
I think what's different about Lalmba is that it really is a center point of the community, and that the staff lives nearby, they come in, it is such a community within itself. Every day felt like friends were greeting, meeting together, getting ready for the day, talking about their family, and in that I think it's special.
Some of the medical cases that I have seen while being here are things that I had learned about in medical school but have never got to see in practice, and that has been an incredible opportunity, such as different malaria and yellow fever and a lot of the different worms. That is not something that I have a lot of experience with, so that was really special.
One case that I had never seen before was when we were in one of the other remote clinics, and we saw a gentleman come in who had elephantiasis, which is a worm's infection in the lymph nodes that caused his leg to swell up significantly, and it was draining fluid at a pretty rapidly rate. And that's something I'd only read about, I'd never seen before. And we were even, after seeing it, having to look up how exactly to help take care of that. But I think we were able to get that gentleman good care, even in a very limited resource setting. And so it was great that we were able to be there that day.
So something that I have taken away from this experience is just about how, as clinicians, it is so important for us to be open-minded and to see different ways of practice. Not only do I have a lot of new clinical experiences, which has been very exciting for me. You know, I've read about these things in medical textbooks, but have never seen them with my own eyes. I remember the first case I saw of malaria here in the clinic. It was somebody that came with a headache and GI symptoms, and I said, "Oh, it is a viral illness." And the clinician said, "This is malaria," and it was malaria.
Lalmba, I think, stands out amongst a lot of global health providers as being built around empowering the community to take care of itself. And so that means that it's finding providers from the community, finding pharmacists from the community, finding resources from the community, buying even products from Kenya and from the community to really build the health system up instead of just sort of transport a Western healthcare system into a rural setting. And I think that is uniquely different and far more sustainable and helpful for the community than a lot of other organizations that just sort of transport providers and equipment into other places.
So what I really love about Lalmba is that here in Matoso, it is all local staff taking care of the community. It is not, for example, with medical missions where doctors come in and then they leave and then there's no follow-up. The staff here see the patients, they see the community, they know the patients, they are here day in, day out to take care of them. And what we are doing is more capacity building and helping their knowledge base, helping them with their skills versus actually just taking care of the community. And so in that way, it's there's sustainability with this model, and that is something I really appreciate.